Hello everyone, I'm Gabriela ILLES. I'm an infectious disease specialist and I'm working with a geriatric doctor at Clinique Des Augustines in France in a wound care specialist service. So I will present some cases here how we can heal infection in wounds and without using antibiotics. So, when you have a wound, a chronic wound, you must know where you are on this scale because you have a lot of stages about this wound and you must know if you are on the side of the contamination, colonization, you don't have to use any antibiotics. And you see that there is no reaction about the wound and the wound is healing quickly. When you have a slightly infection, you can have increasing exudate and also a delayed wound healing beyond expectation. You mustn't use, in this case, any antibiotics because if you use antibiotics, oral antibiotics, you will have a lot of selection of multiple bacteria. When you uh, when you are at the classic local wound infection, you can have a purulent discharge, you will have your wound who will grow, and you have a lot of pain. Here, you must use antibiotics. But what antibiotics? Because if you are taking a swab on this wound, you will find a lot of bacteria. You will find probably Pseudomonas aeruginosa. And we know that it's difficult to treat this infection, and here it's not an infection, it's only the biofilm. But under this line of biofilm, the Pseudomonas aeruginosa, you will have also streptococcal and staphylococcal. So if you need to treat with antibiotics, what you can use only amoxicillin is sufficient, or amoxicillin acid clavulanic, for example, if you want to have staphylococcus. So we can also do something in this wound with different technique, and here we will talk about DEBRICHEM. Of course, if you do nothing, the patient can have a real great sepsis and you will have fever, and there the management of the wound it's in the second plan because you must to save your patient and use normally intravenous antibiotics. So when you are the spreading infection or systemic infection, you must treat your patient with antibiotics, and the wound will be treated after that because you have a high catabolism of the person because she has this infection, and also the wound will grow with or without antibiotic. So what we can do when we are not in sepsis, in highly sepsis? We can use a local gel, DEBRICHEM, donc without any antibiotics, and you can apply one single application of 60 seconds. What's this gel? This gel is causing something like burning because it's an acidic principle who will dissociate and produce protons and anions that bind the water molecule that we have in our biofilm and in bacterial walls. So we know that on the healthy skin, we have a lot of lipids, so it's not toxic for the skin around the wound. Here is a patient that has this treatment, and you can see that we apply DEBRICHEM also on the wound, but also around the wound, because your biofilm will not stop only on the bed of the wound. So it is important. When you don't have to use DEBRICHEM, when you have a very ischemic ulcer, when you have a neoplastic ulcer, also when you have osteomyelitis, because we know we can have a wound, but we will always examine your patient and you will see if you have a cartilage or a bone contact. And in this case, you must think not use this product. Of course, this product will not work on dry, full thickness scar. You must debride this dry tissue, dead tissue. So here you have a case where we used DEBRICHEM application after that we applied lidocaine gel for relief the eventually pain. After 1 minute, we rinse it with a solution of saline, cooled at the freezer, and we have on the second photo what's going on the wound after after the saline lavage. And we see that you have a layer of carbonization. So what we can do, we must do anything, because this layer of carbonization is there to protect your wound. And under this layer, you will have granulation. How can we improve granulation in this case? This patient had a mixed ulcer, so it's not only the venous insufficiency, but also the blood vessels are not so healthy. So what we can do is use in combination after this treatment immediately negative pressure wound therapy, who will get everything around the wound with drainage of the lymph, and also with more blood in the wound. So, if you combine these two techniques, you have a recent study. It's not a large study, but this is what I see in my daily practice. You can have a granulation in less than 2 weeks. I will present a case with calciphylaxis, DEBRICHEM, and negative pressure wound therapy. You have here a woman who has a very, very painful ulcer, who has a pacemaker, so a high risk of infection on this device. She has also a left hip prosthesis, also a very high infection risk. And also you can see that there's obesity and a stroke, and he's not very healthy. So what can you see here where the marker is? It's a calcification. And you can see that you have a redness around your wound. When we take a radiography, you can see all the calcification, because calciphylaxis is uncommon disease in which calcium is accumulated in all these small blood vessels of the fat and the skin, and they cause blood clots, and you have painful skin ulcer, and you have a lot of risk of infection. You must know, when you are at this stage of calciphylaxis, only 20% of person will survive after 6 months. So the quality of life is so important in this patient. We must get rid of the pain, we must get rid of the risk of infection. So this approach, it's so interesting, because these patients must live their life, risky life. So what we did, here you have on the first picture, it's just after the DEBRICHEM. You have here on the bottom of the picture, you have just after DEBRICHEM, so you can see carbonization layer, and also the calcium that is right in the middle. We can't remove this because it's very painful, and also that can bleed a lot. The patient has a second ulcer on pretibial, who was treated also. You can see here that we used a negative pressure wound therapy on the big wound, and we used something else on the second. So what's going on? You see here on the first day that you have all this carbonization layer who is going slightly only with a compress. We don't do any mechanical debridement. Also, you can see that your skin, you don't have any redness, and you don't have inflammation. You don't have a biofilm. This is why. And after 7 days, you have a wound who is ready to get skin graft. Why? Because you want that this patient has no pain and that she can go home, and you diminish the risk of device infection. here we can see it's the 7th day. I'm sorry, on this side it's not 4th day. No, so we have the wound 7 days after DEBRICHEM, and we did skin graft. It's very simple. Any doctor could do that in ambulatory also. So if you know how to do your biopsy, you use the same device. It's not expensive, and it's quickly, and it's pain relieving also. Donc you can see here that you have already the skin graft with vascularization, and the patient don't have any pain, don't have any more morphine. So what's going on after? You must to protect your skin around the wound. We apply a foam, but you have also a lot of other types of solution, but you must know that you can't use anything because you must test this before. Why? You will use negative pressure therapy, and you must have a good adherence on the skin. Sorry, it's going too fast. So here you can see after 3 weeks, after the skin graft, you can see the epithelialization here, and we didn't do any mechanical debridement. Everything, all the layer of carbonization is gone simply with a compress. So she goes home after 3 weeks, and this is the first wound that you see on pretibial. She had the same treatment, but she didn't benefit of the negative pressure therapy. And you see that the grafts are there, and it's going very well. And I would like to invite to join us in Barcelona for annual meeting of the European Bone and Joint Infection Society, because you see that wound is important, but you can have also infection on this device. Thank you very much.